As we all know, it was a little bit more than a year ago when the Affordable Care Act was passed, and there has been a lot of questions, commentary, confusion about what the impact might be for various businesses. So today we actually have a very interesting panel because we have just about every aspect of the program covered. So our panelists today include Giovanni Gomez. Giovanni is the Regional Coordinator of Outreach and Consumer Education for the Illinois Health Insurance Marketplace, which is Get Covered Illinois. We have Susan Koski, on-the-job banking health savings specialist, and she is going to talk about it from the employee impact factor. We have Russ Warye, who also happens to be one of the directors here at the Chamber. He is a full-service employee benefits and financial consulting firm, Russ Warye, Inc. Terri Olian, to my immediate left here, is the project manager for Enroll Lake County. Enroll Lake County is the countywide initiative led by the Lake County Health Department and the Community Health Center, so their job is education of the public. And then we have Shawn Dorgan, Director of Channels at Land of Lincoln Health. So we have insurance, we have benefits coordinators, we have educational component, we have a broad-ranging point of view and perspectives that we'll have. So I think that the logical thing would be to go right down the panel and talk about just in a few sentences each, because obviously with 5 of you we have to be limited. But let's talk about where we have come, starting from when the Affordable Care Act was passed last year in the fall of 2013, where we are today, what has changed, and where you perhaps see that we're going to go. So we'll start with you, Terri.
I'm just going to stand a little bit because there's people over here who I'm just not that tall, and so you can't see over the
I can move back.
That's okay. So I represent, and what we do mostly is help individuals and families obtain health insurance who do not have it in Lake County. And the long and short is that over the past year, we have enrolled over 13,000 individuals and families in health insurance plans, Medicaid or private insurance plans through the marketplace. We have personally assisted over 18,000 people, and we have educated far more than that. And our goal this year, it's a 3-month period of time now where the marketplace is open. So we are hoping that we can at least get to 8,000 more enrollments in Lake County.
All right, thank you, Terri. Giovanni?
So again, my name is Giovanni Gomez. I work for Get Covered Illinois as far as the state's initiative implementing the Affordable Care Act. We work closely with the federal government. Mostly going to stick into what it means to the small business owners. We've worked very, very closely with the producers. We have a new producer program where as long as you're certified with the federal government and you're certified with the state of Illinois, small businesses can actually go on our website, Get Covered Illinois, search for a producer to help them know exactly what their options are. We know that there's a lot of questions out there. Business owners really want to know, where do I stand? Do I need to comply with the law? Who can really help me out? We've done a lot of those factors in order to help integrate the implementation with small business owners and the producer community. Along with that, there also has been enhancement to healthcare.gov to help small business owners define where their business stands. And if they do qualify for a tax credit, what is that estimated tax credit could be when they do file it. So we're working on, as far as the ground level, Get Covered Illinois to help and educate and implement all the aspects of the Affordable Care Act and the state's responsibility aspect.
All right, Shawn.
Good morning. How's everybody doing? I'm Shawn Dorgan. I'm the Director of Channels for Land of Lincoln Health. I was here last year. Thanks again for having me again this year. We're focused on providing high quality health insurance to everyone here in the state of Illinois. That's at the individual level, at the smaller employer level, and also at the large employer level. So I work with organizations like Terri's and Giovanni's, helping individuals get insurance, but I also work with guys like Russ to make sure that employers have access to really high quality insurance. So last year, we were about a year old and trying to get out the gate as fast as we could. Had a challenging marketplace to go up against. There was about 6 carriers with 165 different plans. This year we have 8 carriers with over 500 plans available to people here in Illinois. So I think one of the big changes you're going to see is that there's a lot more options with a lot different looking plans that you're going to need a lot of help kind of getting through. And there's a great cross section of people up here to be able to help you, whether you're an individual looking for plans or a group looking for plans. There's a lot of good people up here who can help you out.
All right, thanks, Shawn. Russ Warye.
Hi, everybody. My name is Russ Warye. I run an employee benefits consulting and brokerage firm. I've been in the business for 24 years now, helping employers and individuals find health insurance. and you've got great partners up here that can help you do the same thing. We just got approved as an advisor on the Get Covered Illinois program. Like Shawn said, we work with Land Lincoln, Blue Cross, Aetna, Humana, United Healthcare, trying to help all y'all find the best coverage you can get for the dollar out there. And I think what we've found is that with the rollout of the Affordable Care Act, it's just made it very confusing for individuals. In fact, I think some of the biggest complaints that we're getting are that whole Affordable Care Act thing hasn't come through from an affordability standpoint. Folks who were buying policies that they thought were affordable, maybe premiums were lower, but they were finding that they had limited networks or higher copays out of pocket. So it was making it challenging. And we've got about 8 million people, I think, that have the government's saying that enrolled in the program through the Affordable Care Act. We really didn't get as many as we wanted. And so we're here to help educate you and get you in the best possible place you can be with what's available. So with that, I'll pass it on to Susan.
Yes. I'm Susan Koski. I'm with First Midwest Bank, and I work with employers who've made the decision to move to a high deductible health care plan, whether it be a single offer or a part of a multiple plan offer, in educating the employees to understand not only the insurance side, but there's also a banking side to this product, as well as a tax component. So we work with employers to educate the employees to understand the value of their benefit package. Thanks.
All right, very good. So before we get on to some of the questions that we have prepared for our panel this morning, please remember that this is your program. So if you have questions, we're going to take them as we go, and feel free to address them to any one of our panelists. So I think, Susan, I'd actually like to start with you, because as the benefits coordinator, you must get a ton of questions from your employees about the implications, not only of the insurance for them, but how the coverage may impact their spouse and dependents and so forth. One of the questions that comes up is, can they use their HSA funds or whatever to help subsidize for their spouse and their dependents?
That's a question we get quite frequently, and you can use dollars that are on deposit in your health savings to cover not only the medical expenses of your dependents, and by dependents I include spouse in that, but also the vision and dental expenses too. And those are components that people don't necessarily think about when they talk about the health spending account. Quite frequently I work with individuals who are very optimistic, and they just are not going to get sick. They're not going to break their ankle. Nothing is going to happen. Yet in having further discussions, you find out that they have a 13-year-old ready to go into braces. And wouldn't we all rather pay tax-free dollars on that $6,000 nut to crack versus after-tax dollars?
All right, so I think that would be the next question for Terri. So your job is sort of educating people on the programs. How do you reach that message and that Susan just was talking about, and drill it down to the individual level so they understand how they can really leverage their own situation?
We have a great program. The Lake County Health Department is the lead on a grant through Get Covered Illinois, and we have navigators in over 30 locations throughout Lake County. And people can call our call number, and I will give that to you, and hopefully you will also see on your table some brochures here. Please take those. I don't think there are enough at each table, but I just happen to have a lot more up here that I'd be happy to leave behind as well. People can call 847-377-4999, 847-377-4999. They can call, they can make an appointment to meet one-on-one with a navigator, to start at the very beginning, to look at their options, to go through the Get Covered Illinois screening tool, which is terrific. There are 7 very brief questions that people answer. It sorts people very quickly between the Medicaid application and the healthcare.gov application. Then our navigators work with the individual to answer all the questions on the online application, and the consumer is really the person who is entering the information, but we can help guide that person through the process, answer questions. They're pretty logical questions, but for some people who have never before used a computer, or people who have never had insurance before, it can be very confusing. We submit the application, and healthcare.gov right away, if you are there, they make a determination as to whether you have, whether you are eligible for any tax credits and cost-sharing reductions. Then the navigators explain all that. They go through it. They talk about what that means, where people will see their benefits. You cannot use your benefits on certain plans. You have to go to the silver level often in order to use those benefits. So if you're confused and you're a group who is probably very familiar with healthcare insurance or healthcare coverage or insurance terminology, just imagine the people who've never ever dealt with this. And that's really how we help people and educate people.
All righty, so we have a navigator for the employees, a navigator for the public. Russ, why don't you tell us a little bit about what your firm does in terms of providing the employers with their options for employee benefits?
Okay, well, we represent the entire marketplace, so every top-rated national insurance company. And we work with over 300 employer groups in the Chicagoland market, most of them in Lake County. But, you know, we have a forum here with, how many of you are small employers in here versus large employers, say under 50 employees? So we're mostly speaking to a large employer group here. Do you all have any questions specifically about what you're seeing in the marketplace? What are your advisors telling you? Do you have questions? Would you like to throw them out for me to help answer?
We have one over here.
Has the law changed, or what is the status of the law, whether or not employers have to have insurance going forward? I know there was a year delay on that. Give us an update on that.
Right, so for 2015, employers with over 100 full-time equivalent employees, you have to provide a health insurance, and you are subject to a penalty if you don't provide health insurance. If you provide health insurance but it's not affordable to the employee, then they can go to the exchange, and if they receive a subsidy, you could be penalized there too. So the two things you need to make sure are that you offer coverage to your employee base and that it doesn't cost more than 9.56% of their wage for an individual. If you have less than 100 this year, you don't have to offer coverage at all if you don't want to. Most employers still are, though. Even our small employers that we work with are still typically offering coverage to the employees because it's less expensive, and they can pay their share of the premium, the employee, on a pre-tax basis. So it's less expensive for them to go with the cost sharing through the employer than it is to go to the marketplace and buy an individual policy. And typically the coverage is better through the employer as well.
All right, thanks, Russ. Shawn, maybe you can talk a little bit about some of the specific programs that you have to offer, maybe drilling down to that smaller employee group that Russ was just talking about.
Thank you. Great response, by the way. The rules are complicated and they're changing all the time. So I would definitely advise to work with your health insurance broker. If they don't know what they're talking about, then find a health insurance broker. They are working for you, so make sure that they do their job. There are a lot of options out there. Like I said, there's over 500 options that are available through kind of Get Covered Illinois and healthcare.gov. But then there's thousands of more options that are also ACA compliant that aren't really offered there. And that's really why you need a broker to help sift through some of those options. I represent a health insurance company that's rolling out a whole lot of new plans this year. So you're going to see some preferred partner plans that have the logo of a hospital that you're going to recognize front and center on the product, and they're going to give you a better benefit for going to that hospital. So one example could be Centegra Hospital in McHenry County. So it's not too far away, but over in McHenry, Centegra is a really big health system. We have a Centegra PPO plan. So that means for employees in McHenry County, if their employer chooses that plan, they're going to save some on the premium dollar. They're going to get a better copay and a better co-insurance for using Centegra services. But if they decide to use Advocate, they're still going to be an in-network facility. So you really have kind of a full network of doctors and hospitals to utilize, but there's some cost savings in mind when you go to a preferred partner. Those types of plans you're going to see kind of across the board this year. A lot of us have dealt with in and out of network plans. This is what hospitals have been doing for years, just try to reduce costs on their health plans, is to try to keep their own employees coming through their own health system to keep costs down. So now they're extending, and through Land Lincoln, we're extending these plans out to the community, to individuals and to employers right here in your backyard, right? So there's hospitals all around here that are in Land Lincoln's network that are going to give you a better benefit for going to see those hospitals that you and your families are already likely going to see. So that's just one of many options you'll see out there, and I think you'll see those across the board from a few different health insurance companies. But again, for Land Lincoln, you're going to see them that have the actual logo of the hospital. So there's a little bit less confusion. I think last year what you saw from some of the health insurance companies were different names of a product, right? There was a choice product, there was a precision product, and then there's the PPO product that a lot of us have used. Well, the PPO plan doesn't necessarily have the same doctor as the precision plan has, right? There's a much smaller network, as Russ was mentioning. So the little bit, the difference we have there with Land of Lincoln is really putting the logo of the hospital front and center to make sure that you and your family know which hospital you want to be going to for the best benefits available.
All right, Giovanni, you have the daunting task of working with the navigators to kind of, I guess, convert the atheists, so to speak, the people who are the uninsured, have not yet enrolled, and there have been windows of opportunity when you can, when you cannot enroll, et cetera. Why don't you tell us a little bit about what you're doing with your outreach to try to get the people who are uninsured and convince them to get enrolled in one of the programs?
Sure. So that's actually it's quite a big task. However, when we first started the program back last year, we started with around 1.3 million people uninsured in the state of Illinois. 1.3 million is quite a bit of people to cover just on 1 year. Recording last month, we recorded over 700,000 people have enrolled just for year one. So now that we're going up to year two, open enrollment began last Saturday. It's going to be open all the way down to February 15th. So for this, what we had last year was a 6-month open enrollment window. This year we have a 3-month open enrollment window. At times I like to only consider it a 2-month open enrollment window simply because of the holidays. People are going to be shopping. People are going to have their mind in other places. So the state of Illinois has been known for having a very rigorous program. We've given grant funds to navigate organizations such as the Lake County Health Department. This year we have a new program that was called the GCI Producer Program, where we're involving producers to help us out on the individual basis, on the small business aspect. But moving forward, one of the things that we are noticing that this year is going to be even tougher than last year. Why? Because not only are we working on ensuring the people who did not enroll the first year, but we're also working on the renewal process. So just when you thought, oh my God, I need to sign up for insurance, you also have a different aspect of, oh my God, I need to re-enroll into my plan. I see that I got tax credits. I need to see what my options are, who can really help us out. So we've invested a lot of dollars, a lot of grant dollars on nonprofit organizations, on health clinics, on hospitals, on health clinics, not other organizations to really help us on the ground. What we really are servicing is that one-on-one service, and we're encouraging that one-on-one service. Though you do have the option to enroll online, through the phone, or just by yourself, we're encouraging all the consumers, even small business owners, to meet with the navigator. If you are on an individual basis, please meet with the navigator. If you are a small business or an individual, please meet with them. To be honest with the Affordable Care Act is a very robust document, and simply because we can talk about the Affordable Care Act, but everybody has a different situation. Everyone has something slightly different, whether it's another family household size, whether it's a spouse, whether they're on COBRA, whether they pick this plan. One of the things we're very excited though is, again, what Shawn mentioned, is that last year we had 165 plans with 6 carriers. Now, our success showing that 700,000 people enrolled and got affordable health coverage, now we have over 500 plans with over 10 carriers. So as we can see, a lot of these insurance companies coming into the market and saying, hey, you know what, I see people are getting enrolled, I see there's opportunity, and there's various plans to be able to explore, including Land of Lincoln, Humana, Aetna, Cigna. There's other options. What I encourage everyone, and what we're doing every day, is encouraging that one-on-one aspect. How can we connect you to someone to really explain to you what's happening? Whether it's adjusting your tax credit, whether it's helping you know what health insurance is. We, the state of Illinois, we realize that we're also providing insurance for people who have never had insurance before. So it's quite a daunting task, and it's quite a hard task, not just provide insurance, because it's easy to say, hey, you know what, you have health coverage, but you never know how to use it. Also, aspect is what we're trying to cover is creating a culture of coverage. Okay, now you have health insurance, so do you know what your primary physician is? Do you know how to call them? Do you know how to set up an appointment? Do you know preventive health services are free? Do you know how to use your deductible, a copay? So all that aspect is that we're reaching out to everyone and letting them know it's not just about having health insurance, but it's also about having using your health insurance appropriately in order to really help the system really go through as well. And as well as you're going to start seeing moving forward, you're going to see commercials, you're going to see us on YouTube, you're going to see us on Pandora, you're going to see us on commercials, you're going to see us on the radio. We're literally going to be everywhere informing consumers about that one-on-one basis, letting them know there's an affordability or tax credit aspect to help them get insurance.
All right, thank you very much. Do we have any other questions from the audience yet? Anyone brave enough to ask your questions? Yes, we have. Go ahead.
I noticed you mentioned Cobra. What are some reasons that somebody would take Cobra instead of going to the exchange? Because I think Cobra is much more expensive.
All right, so the question was, why would you elect Cobra rather than moving directly to the exchange? Because it sounds like it might be more cost-effective to do that.
Sure. So actually, I'm probably not. From my experience, what I can tell you is that Cobra it is considered unaffordable. However, from my standpoint on the questions that I've received before, I really call Cobra a double-edged sword. Simply because even though it's an option, maybe you're going through a procedure, maybe you're seeing a hospital, maybe you're going through some sort of medication, and you don't want to move any of your health. You don't want to actually move any of those procedures or move health insurance during that periodic time. It's probably best to hold on to Cobra until you're actually finished with those procedures, and then shift off to another marketplace health plan. And again, I'll pass the mic over in a little bit, but simply, like I said, it's always an option. Cobra will always exist, but at times insurance gets really tricky sometimes where, hey, well, I have this insurance plan and it did cover this doctor, but now I shifted to another doctor, I shifted to another health insurance plan. It has the same hospital, but it doesn't cover my doctor. And then all of a sudden you need to go through another process to see what kind of doctor can I need to help me through my medication or my treatments. So it really comes down to the consumer is, if you're healthy and nothing really affects you and you can just shift on to another plan without anything really affecting, then that's always an option to go directly onto the marketplace and shift another plan.
All right, so let's do a follow-up with that. Susan, perhaps you can talk about how you counsel your employees that separate and what their various options are vis-a-vis that exact question of COBRA versus the Affordable Health Care Act.
Well, unfortunately, I would not be the one to answer that question.
Okay. All right, so Russ will.
Okay, that's a good question, and you have to evaluate the cost versus the benefits that you're receiving, and it could be if you're separating service from a large employer, you might have a really quality benefit plan, and for that same price, you can keep your COBRA and extend that for 18 months instead of moving on to the one of the Affordable Care Act plans. The other thing is, if you have already met your deductible, you probably want to stay on the COBRA plan until the end of the year, and I think that's what Giovanni was maybe alluding to as well. Because then your benefits are covered probably at 100% at that point, and then at the end of the year, your deductible runs up and you start all over again. At that point, you may want to move to one of the plans in the marketplace.
All right, Shawn, it was mentioned earlier that there are so many more people enrolled. I believe Giovanni said it, there's 700,000 out of the 1.3 million. How has that impacted the kind of costs and the plans that you offer? And, what else are you seeing in the marketplace besides Land of Lincoln?
It's a really good question. So I think with that many more consumers to purchase, that there's a lot more competition, and that's witnessed if you look at healthcare.gov again. 165 plans became 500 plans. There's more carriers. So competition is good, right? That's a really good thing as a business owner. If your broker's coming to you with one renewal and that's your choice, that's not good for your business. Having options is a really good thing. So I think the Affordable Care Act and a lot of the things that are happening in the market have driven competition, and that the more enrollment we're getting, the more you're seeing prices come down. It's not a straight line where you have 700,000 people join and all of a sudden your prices drop, but you are seeing a lot of price reductions across, especially the ACA plans. So looking at Land of Lincoln's book of business alone, because that's the only one I can truly speak to, we're saving every one of our employers who are currently on Land of Lincoln plans between 10 and 30% on their current plans. That's huge. We're driving a lot of savings by being a nonprofit consumer-owned and operated plan. And I think you're going to see a lot of competition throughout the market. United Healthcare is entering the ACA market this year. Blue Cross Blue Shield is obviously a huge competitor. And there's a few new competitors like Olian Care that you're going to see out there this year. A lot of different options. Just to segue back to that, the COBRA question, COBRA costs 102% of the current premium. So for an employer, you're probably sponsoring 50 to 75% of that. For an employee, they're used to paying half or a little less than half for that plan. So for them to pay 102% of the full premium is really expensive. So there's caveats there. I would definitely talk to a broker. If somebody is currently going through care, has a child in care, sometimes it's better just to stay with their plan. But the financials behind it make a lot of sense to look at your options and make sure if healthcare.gov has a good option that's affordable, that's going to have good continuity of care for that family, it makes a lot of sense for them.
All right, next question from the audience. Go ahead.
There's open enrollment now, but if you are on COBRA,
So
That's a great question about open enrollment and the implication of COBRA.
I'll answer it quickly, but I'll pass it around too. So there's a thing called special enrollments. So if you lose your job outside of open enrollment, you qualify for a special enrollment. So you can actually go to healthcare.gov, create an account, and shop for plans. COBRA ending can be considered a special enrollment. That's by carrier, but generally speaking, I'll let Giovanni, I think, would be the best one to answer all the different special enrollments that are available.
So you're probably going to start hearing about the end of open enrollment, February 15th, and a lot of consumers are saying, well, what happens to me when I lose coverage and after the end of open enrollment, such as maybe in March or in July. The Affordable Care Act does let people go onto the marketplace even with tax credits, as long as they go through a life-changing event. A life-changing event can actually be losing COBRA, it can be getting married, it could be having a child, getting divorced, moving. As long as you go through that process, you can go on healthcare.gov, report a life-changing event, and you can go on the marketplace and still have these tax credits available to you at the same time.
All right, very good. Terri, perhaps you can talk about, as a navigator, Susan mentioned very early on in her discussion about you have these young people who think that they're Superman or bulletproof or whatever. They're not going to ever get sick, not going to have any accident, no problems. As a navigator, how do you reach that youth element and convince them of the benefits of taking the insurance?
They're invincible, right? It's hard. And so what we have marketing materials, we have everybody in this room, and that's really what we need. We need people to communicate and let people know a day in the hospital, a day in the emergency room, an hour in the emergency room can cost more than the cost of the health insurance. And that's really what we need to get the message. That's the message that we need to convey. People who aren't used to getting sick or fortunately have not been sick think that it won't happen, but you well know that you mentioned breaking an ankle. Things happen. We have insured people who were basketball players as a hobby. They really liked playing basketball. Then they realized that if they broke their leg or if they took a bad fall and went to the emergency room, they'd be in medical debt. The amount of medical debt in this country is astronomical. So what we try to convince people of is you just don't know what's going to be coming, and so it's better, it's always a chance, right? But it's better to be insured than not insured. Now, fortunately, through the ACA, up to age 26, young adults can stay on their parents' plans. That's something new. It's been around since actually 2010, but that's a great benefit. There are a lot of young adults, though, who are aging out of their parents' plans, and that's another group that we're really trying to connect with. So it's convincing people that the costs are less than the benefits and that it is well worth taking the insurance. And it's not just the young adults. There's still a large group of 26 through 55-year-olds who don't quite believe it either.
All right, very good. Do we have another question from the audience? Yes, go ahead. We have two of them.
Just with regards to costs to the employer, there was a perception that there was going to be significant increased costs based on the legislation. Russ, is that something that you're seeing, or Susan, has that materialized and materializing, or is it not?
Yeah, so that's a great question, and it's happening. Rates are going up 20-30% across the board for most clients. Unfortunately, a lot of the business moved last year. The renewals moved to 12/1 because the government said you can keep your plan if you want to for another year. Well, they've extended that again for another year. So many employers have been meeting with them 4 or 5 a day delivering these renewals, and the average increase is approximately 20 to 30%. So especially, it's really daunting on the large employers who now have to offer coverage. Folks that maybe had 30 or 40 people enrolled in the plan but had 140 people that were full-time on payroll now have to bring that amount that they're contributing down, or I mean up, I should say, because the employee only has to pay 9.56% of their pay to participate in the plan. So yeah, the expenses are going up. It's really not more affordable.
All right, Susan, maybe you can handle that from how First Midwest is addressing that issue. I know at my place of employment, it's a never-ending wrestling match every single year. We get the renewal, we argue with the insurance company to try to get it down, we look for competitive bids, and if you move insurance carriers, you have the disruption to your employees. How do you deal with that at First Midwest?
Well, what we're seeing more and more is that companies are electing to offer a high deductible insurance plan, as I mentioned. The cost, obviously, you've got the benefit and risk. The cost is lower because you personally are taking on more of the risk of the cost of health care. So in compromising the $20 office visit and the $500 deductible, you'll have a very high premium for that, which obviously to an employer, they're paying, a big chunk of that also. So by offering a high deductible plan and offering an alternative to that and using the health savings as a component of that, so it allows employees to put money away on a pre-tax basis to cover the increased exposure through the deductibles. First Midwest has actually moved our employee base over. We offer a PPO for those that want that. But we also have a large number of our employees enrolled in the high deductible insurance plan because it's making more and more sense as the cost of coverage increases.
All right, very good. You had a question?
Susan, the use of your HSA account, is that the honor system?
It is. It's consumer-driven healthcare in its truest form. There's no stopping you from doing what you're going to do. I have individuals who are adamant about, they only use their debit card, they only go to CVS, everything matches to the penny. You've got other people who are a little looser with that. I have a lady who just saves up all her receipts all year long. Then she calls me, she'll probably give me a call in about 2 weeks and ask me to cut her a check for the total of the amount of the receipts that she has. And then she uses those dollars for her Christmas fund. That's fine. She has the receipts to offset the dollar amount that she's withdrawing. So truly, this is an individualized plan, and that's part of the beauty and the challenge in it, is that if you're not educating people, then they are more likely to utilize these funds for non-eligible expenses. When that individual is caught by the IRS, and that is the auditing body on this, there's a 20% penalty on top of the taxes that you would pay on those dollars.
All right, so that was actually one of our questions, was what are the IRS implications? But you report the amount deducted, it's up to the employee to reconcile that.
Susan, I have a question.
All right, a question from a panelist. Give him the mic.
Go ahead. Do you offer an option for individuals if they want to leave the money in the account and invest it instead of and make their annual contribution, get the tax deduction, but maybe not use that money to actually pay for health care? Now they want to save it and use it to pay for health care in retirement.
That's a really good question. At this point, we do not offer an investment component to our product. The average balance in a health savings account at First Midwest is $2,344, and I can say that confidently. I looked it up yesterday. But nationwide, that number is even lower. We attribute the higher balances in our account strictly to the education that we provide in the workplace to help people understand how to use these accounts. So we haven't seen a great number of individuals with really what you would call investable balances in these. Most of the employers that I work with are production level type companies, manufacturing, small employers, although we do have a segment at the top of the list that has very robust balances. And I would say, just knowing the names on that list, that most of them are attorneys and physicians with pockets deep enough to pay for the out-of-pocket and save those pre-tax dollars for health care and retirement.
All right, very good. Any other questions? Yes.
With regards to the hospitals that are coming out with their own insurance, is that what you said? How do they address the fact that there are a lot of employees who work here in Lake County but live up over the border in Wisconsin, like myself? So if they're saying you have to go to these hospitals, isn't that sort of discriminating against those employees because they live up over the border?
Yeah, it's another great question. So just from Land and Lincoln's perspective, if you bought a Centegra plan in McHenry County, Wisconsin's right next door, so very valid situation. That Centegra plan would give great benefits for going to Centegra, but if you go somewhere else, there's still a lot of in-network benefits. So we have a standard Land and Lincoln Freedom Plan, which is like a bigger Tier 1 network, which allows you to have great benefits both in Wisconsin and Iowa and Indiana. And if you have a kid in Colorado, we still have a network out there. But we also have HSA plans and kind of more co-pay driven plans that don't have those 3-tier networks, but just have a big, broad network. So for an employer, just like you always have, you can offer 2, 3, 4, even 5 plans to make the most sense for your employees. Does that make sense?
All right, we have about 5 more minutes for the panel. Are there any, you have another question in the back? Go ahead.
Yeah, I want to ask Sue that since you're going with these high deductible plans, do you offer your employees an option for, say, some kind of a accident medical supplement, so that if their kid doesn't break their ankle playing basketball, that they've got money coming in, they don't have to pay that $6,000 deductible out of pocket?
I think what you're referring to is the duck or something along those lines. We do have options available, and it's strictly optional that an employee could participate in. What I see more and more is the brokers offering that up as a component of, while they're positioning the high deductible. I have never purchased one, but my understanding is that an accident policy on a child is peanuts. It's pretty cheap. I have a parcel of kids at home, and I'm never sure who's going to break an ankle at football or, you know. So for me, it would make sense to consider that.
All right, thank you very much. Let's let each of our panelists give us, you each have 60 seconds, one parting shot, one piece of advice, starting with you, Susan.
My advice to anybody who's considering a high deductible insurance plan for their employees is, when you're shopping out the HSA part, to be cognizant of how the delivery is made to your employees. Without the education, you're going to have low participation. Without somebody consulting for them and advocating for them, they're going to find that they're missing opportunity and not capitalizing on the most value that they can earn out of an HSA account.
Thank you very much. Susan Warye?
Yes. So I would just say, as a parting bit of advice, is get educated and work with somebody who knows all the options and can work through it with you to help you make the best decision possible.
Get out there and shop, whether you're a small group, a large group, look at your options. If you're just looking at renewal, call Russ.
I encourage everyone to literally, use the shopping process, get informed about what the decisions are. Like I said, the Affordable Care Act, it can be a robust program, but simply because it's very different. Everyone has a different situation. I encourage everyone to sit down with a navigator. I encourage small business owners to use an agent or broker. And even our navigator program, we don't want to show wrong door policy. So if you're a small business owner and you come up to one of our navigators on our website, we have a producer search tool where we can search a producer for you that's local to you. So please, have a one-on-one conversations with your agents and brokers or with a navigator to help you explore what all the options are.
Thank you. Terri, you get the last word.
So my parting shot is that we are the group to work with, because in Laeke County is the Lake County Health Department plus 10 different human service agencies that have multiple offices throughout Lake County. All of our services are free. We are unbiased. Navigators have an oath, basically, that we take, that we won't steer anybody to any particular plan. In fact, we cannot. It's part of our confidentiality, and it's part of our obligations as navigators. We look at options, but it's up to the consumer. We will help them. But the fact that we offer all of our services free is very important. Another comment I will make is that your businesses, there are part-time employees, there are temporary employees, who, even if a large employer offers coverage to their full-time employees, there are still people who likely are uninsured who need our services. And more likely than not, your employees will have family members, or will have neighbors, or will have friends who don't have insurance. And that's why we are here. We are here to help all of those people.
All right, thank you very much. A big round of applause for our panel. Susan Koski, Russ Warye, Shawn Dorgan, Giovanni, and Terri. Thank you all so very much. It was wonderful. And great questions from the audience, too. I think that you really added an important element to the success of the program.